Hello, hello. All right, we are live. Again, I'm on Instagram, I'm on Facebook. So I love that my team pushes me to do fancy stuff. Hopefully that is fancy. Anyhow, if I'm a new face to you, I am Carmen. I am a myofunctional therapist. I am a therapist, I'm an educator, I'm a trainer, I'm a speaker. I am all things myofunctional therapy. So most of you, if you already know me and you follow me, you know that I spend a ton of time helping educate. So I help people, I help new therapists, I teach the Myo Mastery Program, so I teach new therapists how to do what I do. My new blog came out today called How is Connective Tissue Connected? And here in this live, I'm going to be diving a little bit deeper and talking about how connective tissue plays a role in your body tension. As you can imagine, I have so many clients, and that is their complaint, that they've just always been miserable. In fact, even going back to being a child, for some of my clients, they didn't like to be touched. And that's a question that I ask parents is, so did Johnny like to be touched when he was little? And moms will say no. Every time I touched him, he would be like, ugh. So going back to somebody being a kiddo, that is a way that we can tell that they potentially have some tongue-tie concerns. So when I talk about this, I love this conversation with my clients because so many people come to me and they say, well, I think I have a tongue tie, but somebody said that it might be connected to my tension, that I just always feel like this. And I think that that's absolutely crazy. So husbands are a big thing with this. They just think that's their normal. That's just how they live. So we're going to talk a little bit about that. So first, let me talk about connective tissue versus fascia. This is a phrase that's used quite interchangeably, and I just want to differentiate a little bit. So fascia connects all of the connective tissues in your body, okay? It's around organs, it's around muscle, it's around everything. So if you were to try and pick up like a chicken or a piece of chicken breast, and you know how you get that film, that it's a strong film, but nonetheless you can pick it up and you could pick up the whole chicken breast. So that's fascia. Whereas if you tried to pick up a piece of the meat is going to tear off, and that's muscle. So the fascia really surrounds everything. It holds you together. It connects everything, and it holds everything together. Versus connective tissue is the muscles, the bones, the ligaments, the blood, all of that stuff. So they're used really interchangeably. And I spend a lot of time explaining to my clients, the difference. So scientifically, it's not so important. Really, the take-home message that I want you to take from this is why it plays into this tension. So one thing that I do like to talk about, and unfortunately for Instagram, you don't get to see this picture, but my community on Facebook does, but I'm going to do a good job explaining it for you. So the picture that I share is really the head and neck anatomy. So, from here up. It is showing the hyoid bone. So the hyoid bone is a bone here in the neck. It does not connect to any other bony structures. So that hyoid bone attaches to everything else though. There are 9 skinny little muscles that pull that every direction. The hyoid bone position is important in sleep disordered breathing, sleep apnea. I mean, believe it or not, some people have that bone moved, which it gives me goosebumps when I think about it because it doesn't sound delightful. But that hyoid connects under the tongue. It connects to the clavicle. It connects to the shoulder blades. It connects to the thyroid cartilage. So it connects to everything with these 9 little muscles. So when somebody has a tongue tie, they are rolled forward. So structurally, they are misaligned. And when somebody has structural misalignment, that throws everything off. So other things have to compensate. So for my clients who have tension issues, I mean, I can look at many of them, and when I'm doing their exam and they're standing there like this, a lot of my clients look like this, and they just think that this is their normal. It's the way that they've always been. They've always had tension. They've always just felt terrible here in their neck. But when you have a tongue tie, your shoulders are rolled forward, so that compresses your diaphragm, so that affects your breathing. That's a whole nother conversation. But structurally, it creates tension. And your body, when you do something different, when you're rolled forward, you're pulling somewhere, you're pushing somewhere else. Now, when I talk about connective tissue with my clients, I often talk about Rossiter, and some of you guys might have heard me talk about this. So I'm a Rossiter coach, which is a connective tissue coach. It does nothing for my online clients that I see all around the world, but I throw it out there a lot so you guys know about this, that it exists, or you can find something. Now, I'm not talking myofascial release, but if that's all you can find, this is a little bit different. So Rossiter is a 2-person connective tissue sports stretch. So I help these clients of mine who can come personally to Colorado to my studio. I help them unwind from the inside out, really. So when you have compromised connective tissue, it's just balled up, it's just bound up. It changes that space in your body. And when that space in your body is changed, whether that shoulder's rolled forward, whether it's one shoulder up or down, something inside there is not the same. So when you talk about the connective tissue trains, you could go Google something called anatomy trains. Look at all of those different lines. I've had clients that have chronic lifelong tension, have a frenectomy done, and the bottom of their feet stops hurting. And that's because there's connective tissue from the back of the head all the way down the backside, and it ends under your feet. So, that plantar fasciitis, maybe it's not that. Maybe it's connected with something different. And if you Google this anatomy trains, you're going to see that sometimes these connective tissue lines, they'll start on one side, they wrap around the body. So when I work structurally on somebody in the realm of connective tissue, if they are having a low right back pain, maybe I'm working on the left quad, so it just depends. So it's fascinating if you Google that, those anatomy tissue trains. So this just helps me explain to my clients how connective tissue is compromising. Dr. Zaghi, a mentor, a very big name in the industry, talks often about when you have a tongue tie, it's like wearing a size small. And I always say, we've been there and done that. So if you've worn a size small suit jacket when you should have a large, guess what? You're rolled forward and you can't breathe, you can't move properly. Ideally, we want our ears over our shoulders, so that's a posture issue. That's another conversation. But it helps you understand why you feel the way that you do. It's very common, and it's one of the most the most important symptoms, or most common, not important, but most common symptoms that my clients experience help with. So I often get the question, well, I get massages every Friday. That's fantastic. Or I get regular chiropractic care. That's fantastic. Massage works on what? Muscles. Chiropractic care works on hard tissue, bones. It's a different piece of the puzzle. So when you pay attention and you give some love to your connective tissue system, you're doing a lot different. You're helping to create that space. Your body will heal itself if given the tools. And a lot of people, you would be surprised at the number of chiropractors who come visit me for Rossiter, and they work out, they have beautiful muscles, they look really great in the mirror, and they do this much effort for stretching and maintaining their connective tissue. So it's really, really important. So that's why massage doesn't help. It feels nice in the moment, but it doesn't long-term work because, especially if you have a tongue tie, you're rolled forward, things just are not adding up, and so those things are short-lived. They're wonderful, but they're short-lived. And then one last thing, really, another common thing with my clients is if you're somebody who maybe you have a tongue tie. Maybe you go to the dentist a lot and your bite feels off, and so they're adjusting things on you constantly. That can be a huge sign of connective tissue issues. It can be a sign of a tongue tie. When somebody has structural misalignment and we start equilibrating the teeth, adjusting them, grinding them off here and there, and you come in next week and we need to adjust something different, stop getting your teeth adjusted and start digging a little bit deeper into that connective tissue. That's probably going to be a piece of the puzzle. Okay, I think that I talked about everything I wanted to talk about. Now, the exciting thing is that next week I'm going to be talking more about posture. So this is going to go a little bit deeper. We're going to be talking about how posture is related to a tongue tie. So again, that I think probably digestive issues and tension, headaches, chronic headaches, that is the biggest complaints from my clients when they have complaints. So I'm going to be talking more about that. Now, as you guys know, I do always talk about the opportunity to get my screening tool. So you can do this at the bottom of any blog, or else you can go to Myofunctional Therapy, the number 4, the letter U.com. So that's my website, Myofunctional Therapy, the number 4, the letter U.com/free tool. Many of you don't necessarily just want to jump in and talk to somebody. So you can get this assessment tool and walk yourself through some of these questions that you have. This assessment tool is 25 of the most common questions. It's what my provider partners all around the world use to screen people before sending them to me. So it's going to help you think about, your digestive issues, infant issues that you might have had, trouble with breastfeeding, those different kinds of things. Are you mouth breathing? Does your tongue sit low in your mouth? All of those things. Do you have chronic tension? That is going to help you. So you can go through that assessment tool in the privacy of your home. Nobody knows nobody is going to bug you. That gives you a place to start and walk through. So once you get to that point, then I encourage you to schedule a free 30-minute assessment. And when you do that, like I said, free, totally, it gives both of us a chance to do a couple things. It gives you a chance to meet me. It gives you a chance to get your questions answered and see what it is like to do therapy or meet with somebody on Skype, because I see people all over the world 100% online. So when you do that, I get to answer questions. We get to make sure that it makes sense for you to move on to a paid comprehensive exam, because the last thing that I want to happen is we get to a comprehensive exam, you pay me $125 for that, and then I say, you're beautiful, you're fine. So when we meet, we can talk about the assessment that you did, what you discovered, what questions you have. A lot of people find out about me at the last minute, and maybe you have a frenectomy appointment scheduled for Monday. Maybe your 6-year-old has an appointment scheduled for tomorrow. Who knows? Cancel it. I encourage you, that's why I do these free visits, is so that you can cancel it and understand the process, why it's important to work with somebody. It doesn't have to be me. It just needs to be somebody. And you're not in a hurry. Whether it's an adult or a child, nobody's in a hurry to make this decision like that and not do it right. So that's what the free assessment and the free assessment, that's what they are for. Okay, and then last, I encourage you guys to follow us. So we're small and mighty, we're growing. I have the Tongue Tie and Myofunctional Therapy support group on Facebook. I have a YouTube channel. You can find me anywhere. If you have questions, that is the biggest thing. I spend so much time, my team and I put so much time into educating you so that you don't make mistakes. People are learning. Myofunctional therapy is relatively new, and I just want to make sure that your questions get answered. So I will see you guys next week. We are going to be talking about posture and diving in a little bit deeper to this. So I will see you guys next time. Bye-bye.